Yeah, so I think the sort of gold standard approach is targeted next-generation sequencing to identify these clonal mutations. I think one thing that can be a challenge is that you can have mutations in the Waldenstrom's cells as well as in the sort of normal hematopoietic compartment where the clonal hematopoiesis is, and it can be difficult to differentiate the two. So, for instance, if you find a mutation in the gene P53, that mutation could be in the Waldenstrom cells or it could be clonal hematopoiesis. So when you do next generation sequencing in the bone marrow where you have both cells present, it can be very difficult to determine which one the mutation is coming from. And so I think the better approach is to sequence the peripheral blood. It's not very common to have large numbers of Waldenstrom cells circulating in the peripheral blood, and so if you see a mutation in the blood, it's usually clonal hematopoiesis in those cases. So I think that's probably the best approach to detecting it.